what drugs you will have to take during the course of the treatment and how long do you have to take? Again, this forms of, before patients are starting, this is one of the aspects that they are really apprehensive about. What drugs you will be taking will be based on your treatment protocol that has been formulated following your consultation. And the treatment protocol is based on a list of clinical variables such as the age, the degree of the ovarian reserves, body mass index, the levels of the FSH, and your past treatment history. So you might be taking maybe 3 or 4 injections during the course of the treatment. If you're following a long protocol, you may be taking down-regulation injections such as Biseril and Supracure or Suprafac for nearly 2 weeks. Once you've been confirmed to be down-regulated, or once we confirm that your ovaries have been temporarily shut down, then you'll be taking stimulation injections, which will be at least be 1 injection or could be 2 injections. So at this given point, you will certainly continue with the down-regulation injections till you've been advised to stop. You will be adding maybe 1 or 2 injections on the top, but the good thing is it's only for a short period of time, for around 2 weeks. Once you are ready for the egg collection, you'll take a final trigger shot that matures the eggs, and all the stimulation and the down-regulation injections would stop. So overall, you will be taking these injections as part of the long protocol for maybe around 4 weeks. If you're following a short protocol or a short cetrotide protocol or an antagonist protocol, then you probably would be taking injections only for a 2-week period. And after that, sometimes some specialists or in certain patients, we may use intramuscular injections to support the pregnancy. This is largely the case if patients have had multiple treatment failures and we want to give them the very best chance of conceiving following any treatment. So these are some of the injections that you would be taking in the duration, and as majority of these injections are subcutaneous except few which might be intramuscular. If you're concerned about these medications, then there are other options that you can consider, such as a natural cycle IVF or a mild stimulation IVF. In the natural cycle IVF, you're not taking any injections at all. Occasionally, to salvage a cycle, we may use certain injections, but the whole philosophy is not to use any injections and work with the body's physiology. You may still have to go through an egg collection procedure, but that's a minor procedure. But as far as the drugs are concerned, we are not using any injections. As part of the mild stimulation, you will be using certain stimulation drugs, but the drugs usually used are for a shorter period of time and the dosage of the drugs are reduced. And the philosophy with the mild stimulation is, the school of thought is to collect fewer eggs but a better quality, whereas with the conventional IVF, the philosophy is an appropriate stimulation which is suited for the patients, because the studies have certainly shown that nearly 10 to 15 eggs are required to give the patients a very good chance of the success. So the philosophies for both the kinds of the treatments are fundamentally different, and that leads to the decision as to what medications will be used and whether we use any medications at all. And also it's important is to take into consideration what your beliefs would be. I certainly sometimes have patients who do not want to use any injections. Then in that case, we will consider natural cycle IVF. Or on the other hand, we've gone through a conventional IVF and giving them large dosages of the drugs have yielded only 1 or 2 eggs. Then again, we will revert to going natural cycle because the body is doing it naturally anyway. So really it depends on a variety of factors, clinical factors, and your choices and belief that leads to what drugs you would be using as part of the treatment.